All right, let's jump right in. Today, we are tackling a medical emergency where every single second counts. The ST segment elevation myocardial infarction, or as you know it, a STEMI. This is the big one, a complete blockage of a coronary artery that puts the heart muscle on a direct path to serious, irreversible damage. We're going to break down what's happening, how doctors spot it, and the absolute race against time to get that blood flowing again. To give you a sense of the scale here, just look at this number. Every single year in the United States, about 605,000 people have a new heart attack. That's a staggering figure, and it really underscores just how common this life-threatening event is. And here's the really sobering part. For a huge number of these people, the clock runs out before they can even get to a hospital. This shows it's not just a medical problem, it's a systems problem. It's a race, or what happens before the emergency room is often the most critical part of the fight. And that is precisely why understanding this whole process and the system built to fight it is quite literally a matter of life and death. The difference between someone walking out of the hospital and a tragedy is measured in minutes. Okay, so what is a STEMI, really? Well, it's a very specific, very severe type of heart attack where one of the heart's main arteries is 100% blocked. And the key, the absolute game changer for spotting it instantly, is the electrocardiogram, or ECG. It shows this very distinct, telltale pattern called an ST segment elevation. Now, saving a life here isn't about some lone heroic doctor. Not at all. It is all about a highly coordinated chain of survival. Every single link, from the paramedic who shows up at the door to the specialist in the hospital, has to work together, seamlessly, to get that artery opened back up fast. But what's actually happening inside the body to set off such a catastrophic event? I mean, how does a vital artery, the lifeline to the heart, just suddenly slam shut? It all starts with something called a vulnerable plaque. And honestly, the best way to think of it is as a ticking time bomb hiding inside a coronary artery. It's this fatty deposit with a really thin, fragile cap just waiting for the right moment to break open. So when that plaque finally ruptures, the body's emergency response system just goes into overdrive. Platelets scramble to the scene, the whole clotting system fires up, and within moments, a solid clot forms that completely seals off the artery. This four-step cascade, this is what directly causes the STEMI. Now, you might think the amount of damage to the heart muscle is random, but it's not. It's determined by a few key factors, and the most critical one of all is the duration of that blockage. The longer that artery stays closed, the more heart muscle dies. It's a direct, unforgiving relationship. Time is muscle. Okay, so the disaster is happening on the inside, but how does the body send out an SOS? For a clinician, it's like being a detective, piecing together a very specific set of clues to make a fast, life-saving diagnosis. Pain is almost always the number one symptom, and we're not talking about just any pain. The words patients use to describe it are powerful. They're visceral, heavy, squeezing, crushing. It's this profound, deep, and often terrifying feeling that screams something is terribly wrong. And this combination right here, this is a massive red flag. You've got that persistent, deep chest pain that lasts for more than 30 minutes, and it's accompanied by profuse sweating. When you see those two things together, it's a full-blown medical emergency that demands immediate action. But, and this is a huge but, it's not always that classic crushing chest pain you see in movies. Sometimes the clues are way more subtle, especially in patients with diabetes or in the elderly. They might just get hit with sudden weakness, shortness of breath, or even just a vague sense that something is terribly wrong. This is why you've got to have a high index of suspicion in these groups. And you know, a quick physical assessment can tell you so much. You can often just see the distress. The way the patient looks, anxious, pale, sweating, it tells a story of profound stress on the body, even before you've hooked up a single monitor. So once the diagnosis is confirmed, the mission becomes singular and incredibly urgent. Restore blood flow to that starving heart muscle. This is called reperfusion, and it is an absolute race against time to save as much heart tissue as possible. This brings us to a huge decision point. The artery is blocked, the clock is screaming, and a choice has to be made, and it has to be made in minutes. Every second that goes by, more heart muscle is dying, so the pressure is just immense. You've basically got two main strategies. There's primary PCI. Think of it as a mechanical fix, where a catheter is used to physically open the artery. And then there's fibrinolysis, which is a powerful clot-busting drug. Now, PCI is the gold standard. It's just better at opening the artery, but it requires a specialized cardiac cath lab and team. If a patient can't get to one of those labs fast enough, then fibrinolysis becomes the life-saving alternative, buying precious time by dissolving the clot. And success here is measured against the clock. These are not suggestions, they are hard and fast deadlines based on the brutal biology of dying heart cells. For fibrinolysis, the door-to-needle time has to be under 30 minutes. For PCI, first medical contact to device time needs to be under 90 minutes if you're already at a specialized center, or under 120 minutes if a transfer is involved. Hitting these goals directly translates into saving heart muscle, period. And this brings us right back where we started, to that chain of survival. You see how every single link has to be strong and has to be fast. It starts with the patient recognizing something is wrong and calling for help, and it ends with that blocked artery getting opened within that critical time window. A failure at any one of these steps can jeopardize the entire thing. And this really is the ultimate challenge. We have the science, we know exactly what to do, but in the world of STEMI care, knowledge is not enough. The real test is our ability to build and to relentlessly optimize the systems that deliver that care against a ticking clock. Because in this race against time, every single second saved is a life potentially won.